So if you want to work as a pharmacy technician, you got to get your pharmacy technician certification. Many of the pharmacies allow you to work as a trainee for 2 years, but after that you definitely got to go take the exam. And some other pharmacies require you already be certified in order to work for them. So either way, you have to take the exam at some point in order to become a pharmacy technician. Now the exam does require some studying, so I'm going to show you guys some of the strategies I use in order to get a 98% on the exam and get my certification the first time taking it. Now for most pharmacies, you're going to be taking the exam through the PTCE, which is the Pharmacy Technician Certification Board. Usually the certification that you get from them is accepted around almost all pharmacies, so this is probably the best certification to get. For most pharmacies, you can get a trainee license where they allow you to work in your state for up to 2 years in order to learn and get a handle on things in the pharmacy before you apply for your actual certification. Now I really do not advise waiting the complete 2 years before you try to apply for the certification. I recommend at least a couple months, maybe a year before it expires, that you apply for the certification exam, because if you do fail the exam, you do want to retake it. You want your trainee license to still be available to you and allow you to still work, because if you do fail the exam and your trainee license has expired, you won't be allowed to work anymore until you can get fully certified. So I do recommend leaving some time for yourself if you do fail. You can easily sign up for the exam by making a profile on the PTCB website, and after that they will give you all the instructions you need in order to sign up and take the exam near you. The certification exams are going on all year round, so you can sign up and find the most convenient time that works for you. Now after you sign up for the exam, you definitely do want to study. It's not a very intuitive and easy exam to get through. You definitely need to put in the time studying for it, but here's some tips that can definitely help you out while you're studying. My first one is that if you're already working as a trainee within the pharmacy, it really helps to be able to ask your pharmacist questions and have a daily interactions with the medications when you're filling them, when the patients are asking questions. It really helps to have those experiences firsthand with the medications and with the policies around the pharmacy. So anyone who is already a trainee, it gives them a big advantage when it comes to studying for the exam, because they also have first-person experiences. I know for me personally, I can recall many experiences where the patients came up and they were asking for a brand name medication, and I looked in their profile and I'm not seeing anything named Lexapro. I don't see any. They're asking for Lexapro and I don't see Lexapro. And I go over, after they're already getting mad at me for not being able to find it, I go over to my pharmacist and I ask, what's Lexapro? And she's like, oh, that's escitalopram. I'm like, oh, that's the brand name for that medication. And guess what? In the exam, when I'm being asked about the brand name for escitalopram, I immediately remember it because I have those experiences from the pharmacy, either when patients are getting mad at me or when I'm asking my pharmacist questions. And those experiences really help you learn in a deeper level than just studying. I work in CVS Pharmacy, and they have specific policies regarding drug classifications where only pharmacists can fill certain drugs. So any C2 drugs that are a little bit more controlled, you have to have the pharmacist fill it. So having that kind of policy around you and being able to deal with that policy teaches you the drug classifications too. Even some of the medications that are C3 medications, you can't reprint on your own. You have to have the pharmacist come over and print it for you. So having these little tiny experiences really teaches you about the content that's going to be on the test just from experiential learning. Now definitely don't underestimate the studying that you have to do. You do have to separate time for studying. It's not just I'll do a 10-minute study and then I'll be good. No. You have to have an actual window of time within your day where you're studying for an hour, 30 minutes, just consistently for maybe a month, maybe 2 months, in order to really get a grasp on the concepts and the medications. I know for myself, I had to do my college courses at the same time that I was studying for the exams, so every time I came out of my course, I set a specific amount of time between each course that I would have to just study for certification exam and just focusing on that material instead of multitasking multiple subjects and courses. Another tip I have is you don't want to study passively where you're just reading about the medications or you're just watching videos or you're just flipping flashcards over and over again. You really want to engage in the studying. You want to have the active recall, the repetition. I definitely used videos, I definitely used reading, I definitely used flashcards, but you have to to really engage in it, where you try to challenge yourself, quiz yourself constantly. And if you have other people that can ask you questions, have them ask you questions about the medications, about the policies, about the regulations on medications. That really helps you get the information in your head. Now, in terms of how much time you want to spend on studying, it depends on how much knowledge you have and how long you've been working. I know for me, I was working for at least a year in the pharmacy, so I knew a lot of things about medications, especially if you're curious and you ask your pharmacist all the time and your pharmacist is willing to teach you about the medications. You can accumulate a lot of knowledge, so your studying time might be able to get cut down a lot. I would say for most people, around 1 to 2 months of studying is totally fine. I studied for 4 months because I was super paranoid about not passing, so that was a bit of an overkill, but around 1 to 2 months of actual productive studying should be enough. Now, here's the thing you've all been waiting for. Here are the resources that you can use to study for the exam. My favorite go-to resource for this exam was the PTCE practice bank. This is an official practice bank study guide, whatever you want to call it, from the certification board. The people that do the exams, that conduct the exams, also make this practice bank. So this is the most accurate way that you can study for the exam. All the questions are formatted exactly like they are on the exam, and keyword is formatted. They're not word by word exact same questions that you'll see on the exam. They are in the same kind of format or same kind of problem, but it's not going to be word for word the same questions. They give you an organized list of questions regarding dosage, regarding medications, regarding pharmacy law. So overall, this practice bank is really helpful. The only downside is it's $65 to purchase the practice bank. But realistically, if you pass this exam, that money will come back within 1 shift of working. So in my opinion, it's worth it in order to be able to pass the exam. It's the most effective studying tool that I found. You definitely want to focus a lot on medication names. They're going to ask you a mix of brand names and generic names, so it's best to practice both of them and really get them to stick. So in one of the questions, they might ask you what medication is used for high cholesterol, and there are going to be a bunch of options, and it could either be rosuvastatin or Crestor. Could be either one. It's just random whenever they give you the medication names. It could be brand name or generic, so you want to make sure you know both of them. Another thing you really want to focus on is the classification of the medications, because if you really just try to focus on the top 200 medications and memorize them individually, it'll seem like just a scattered list of a bunch of mess of names. But if you focus on learning the classifications, it'll be so much easier to know what medication is for what. For example, if you have ACE inhibitors, it's going to be lisinopril, ramipril. All these pril endings are going to be ACE inhibitors, which are for high blood pressure. So learning the classification kind of helps you make groups of medications in your head where you know which medications are used for what. And lastly, obviously, we want to know what the medications are used for. So studying the indications of the medications and the contraindications, interactions that the medications might have with other medications or foods or even supplements. Definitely do focus on studying the top 200 drugs because that is really important to the exam. About 35% of the exam is actually just purely focused on medications, so definitely do focus on learning as many medications as you can. That'll help you avoid any mistakes when it comes to this large portion of the exam. About 23% of the exam is about patient safety and quality assurance. So that's going to ask you if this medication expires on this day, when do you throw it out, or what is the purpose of tall man lettering within the pharmacy. So anything relating to the patient's safety or making sure that you're dispensing medications correctly. Another big part, which is 22% of the exam, is order entry and processing. So that's going to ask you if the prescription you receive says 1 tablet PO, BID, PRN for pain, you have to be able to translate what the entire prescription is saying to you. So you have to really know your abbreviations. That PO stands for by mouth, PRN is as needed, BID is twice a day. You have to really memorize these abbreviations. And about 18% of the exam is federal requirements, which are just the laws I was talking about earlier that you mostly will get familiar with as a trainee, regarding the classifications of medications, which forms you have to fill out, and the limitations depends on getting medications. For example, controlled medications most of the time only have a 6-month window before they get expired. Or depending on your specific state, C2 medications can't get transferred between different pharmacies. So it's just federal laws and policies like that. There's going to be some math questions on the exam that are going to require very basic algebra, division, addition, just basic arithmetic in order to solve them. It's going to be basic questions asking you to solve for the day supply or the dosage of a medication. And finally, the last resource that I would highly recommend is Amanda PharmD videos. Her videos are super helpful. You can watch them, take notes, but they were extremely helpful for me to memorize the brand names, the indications, and the classifications of the medications. So definitely do give her channel a visit. I think it can be really helpful for you guys. But that's pretty much it for this video. I hope you guys are able to use these resources and pass your exam and get your certification. If you enjoyed this video, give it a like, subscribe to the channel, and I'll see you guys in the next video.